Newquist. Berkowitz. Diaz.
Here.
Logan.
Here.
Parker. Revis.
Here.
Richmond.
Here.
We have a quorum.
Excellent. All right. First item up is approval of minutes. We have quite a few of them here. Just want to thank everybody that worked on these and got us all caught up. So thank you very much for your hard work, dedication in getting this done. And first one up is going to be, I'm looking for a motion for to approve the Will County Finance Committee meeting, regular meeting minutes from November 7, 2023 at 11 o'clock. Can I have that motion?
Motion for second is.
Roll call, please.
Berkowitz?
How do I keep it on? Hold that 1 second. Oh, sorry. Don't shut yours off, Perla. You just keep yours on, okay?
Berkowitz.
Yes.
Diaz.
Yes.
Logan.
Yes.
Revis.
Yes.
Richmond.
Yes.
Motion carries.
All right. Next item up is Will County Finance Committee meeting, minutes, recess meeting from November 13, 2023 at 11 o'clock. Can I get a motion?
Motion Diaz. Second Berkowitz. Somebody.
Previous?
Second Diaz.
All in favor? Any opposed? Motion carries. Third item up, Will County Finance Committee meeting, regular meeting for December 5th, 2023 at 11 o'clock. Can I get a motion?
Motion Berkowitz. Second Diaz. Second Diaz.
All in favor? Any opposed? Motion carries. Fourth item, Will County Finance Committee meeting, regular meeting, January 2nd, 2024 at 11 o'clock. Can I get a motion?
Motion Berkowitz. Second Diaz. Second
Second.
Diaz.
Okay. All in favor? Any opposed? All right, fifth item, the approval of the minutes for Will County Finance Committee meeting, regular meeting, February 6th, 2024 at 11 o'clock. Have a motion?
Motion Berkowitz. Second Diaz. Second Diaz.
All in favor? Any opposed? Motion carries. Will County Finance Committee meeting minutes for a regular meeting, March 5th, 2024, 11 o'clock. Can I get a motion?
Motion Berkowitz. Second Diaz.
Previous?
Second Diaz.
All in favor? Any opposed? Motion carries. Will County Finance Committee meeting minutes for regular meeting, April 2nd, 2024 at 11 o'clock. Can I get a motion?
Motion Diaz. Second Berkowitz. Second Diaz.
All in favor? Any opposed? Motion carries. Last and final one, Will County Finance Committee meeting, regular meetings, regular meeting minutes for May 7, 2024 at 11 o'clock. Can I get a motion?
Motion Diaz. Second Berkowitz. Second Diaz.
All in favor? Any opposed? Motion carries. Old business, we have two items on the agenda today. First item up is the HERO organization. Second will be family guidance. And what I'd like to do is limit you to like 5 minutes. I know we've talked to both of you and you've worked with the committees that are talking to us. So if you come up, just give the finance committee meeting a little bit of an update on what's going on, and then we can go forward from there. So first one up is HERO organization. I don't know who's coming forward, if it's Janet, I guess. See a couple folks out there, so.
Sure, I'll take care.
If you could just state your name, that'd be great when you.
I'm Dr. John Roberts. I'm the president and founder of HERO, Heroin Epidemic Relief Organization.
Jason Moss, board member for Heroin Epidemic Relief Organization.
If I get the packet or information? And did everybody get a chance to take a look, see their van and trailer that was out front in that? Okay. So the floor is yours for 5 minutes.
Well, I'll try and make these 5 minutes count because they're very important to Hero and to our organization, but also the families in Will County. Ladies and gentlemen, I've been running this organization as the president for 15 years, but what started me is when I lost my 19-year-old son, Billy, to a heroin overdose 5 years after I retired from the Chicago Police Department and moved here to take a job at Lewis University as a professor. After all that work in my doctorate, I dropped that to turn to this work. I've been doing it, not every day, but it's virtually full-time. I'm here for families. I know what families go through. And the young man who's with me is in recovery. That's the work that we do. I fought and fought and fought like so many families do every day in our county to save the life of a loved one from the substance abuse. I decided I'm not going to just talk about it. I'm going to do something about it. I didn't wait for funding. I was a private organization, but something I'm particularly proud of and why we're here today is that at our inaugural event, there were 3 Will County executives that stood on the stage with us. And they've been at our side and we've been at their side. I called us a public-private partnership, the likes of which we don't often see anymore in government, but we came forward and you guys have been great to us. So now we can do more. We know we can do a lot more. And with a little bit of help from you, we will. And I'd like to turn it over to Jason and let him give you an idea of some of the work we do. I gotta hit. You're ready.
I'd just like to add a personal side to it. John mentioned all the work we do. I just want to share a little story. I was about 3 months sober. Just lost my dad to this disease. And I was asked to volunteer for Hero. Didn't know what I was getting into. Didn't know what I was going to say. And I met a grandfather who just lost his granddaughter to an overdose. And he was introduced to our grief and family support program. What I've learned is we can't battle this war, if you will, without an army. We offer a basis for families to come to join that army. We struggle with feeling like we're alone. I think in the last 5 years, it's become more out in the open. There's still a stigma with addiction. Families that are struggling feel alone. We're in a position today to give people a safe space to figure out how to navigate grief. We would love to see this epidemic end. The reality of it is we're fighting a battle right now where there's no end in sight. So we're coming up with solutions to mitigate the damage. And with that is where Hero comes into play, giving families an option to not suffer in silence. Unfortunately, we have a family member that I consider all the people that come to Hero family, but a family member that lost a loved one. She was part of our family support group and unfortunately graduated to our grief support. She gives families today hope that will never get rid of the pain they're going through, but they can find a way to deal with it and help others. And I think that's our mission, to be a place for others to come and be of service. Thank you.
Can I add to that the day that my son overdosed for the first time at home, he was taken to Silver Cross, the old Silver Cross. It was a Saturday night. We left there at 4 a.m. with a list. It had been copied so many times that it was dog-eared, but it was a list of all the resource providers. My family and I went home and we talked about it the rest of the night while Billy slept off his overdose incident. But I called every phone number on that list and most of them were closed. So my son almost died that night. We left the hospital with the list. So I'll never forget that feeling of what my family went through and what we felt like. And where do you turn for help? That's what Hero does. We fight for the family. We know what it does to the family, and the best resource you can give to a person fighting to regain their life and recovery is to help their families. They appreciate that the most, both sides, the family and the loved one who's struggling. So in a word, yeah, family. We fight for the family. We've been doing it for 15 years. This man is now 6 years in recovery, and there's nothing I wouldn't do to help him. And if there's something I need for him to do, if it means that he's going to lose his recovery, Hero will do without. That's our policy. It's about bringing people back to the life that the good Lord gave him and allow them to lead that life. He's doing great. He's always been steadily employed. How he's done that, I don't know. He's raising his family. He's doing amazing things. He's a productive, contributing member, not only of the society, but he's been working with Hero and doing this now for other families. It's a new theme that I thought about. They rescue themselves with help and then they reach back. He's rescued so many people. We're on a roll here. We've got some really good programs and ideas. And with your help, we guarantee you, we're going to continue to do this. I made a pledge the day after my son died that I would do this work until I joined him again. I promise you, I will do this work until that time. I'm pretty healthy. I'm going to be around a while. So if you want to see us, what we can really do, please look at what we've done and then extrapolate where we can go from here with your help. It'll be wonderful. So thank you for allowing us to speak today.
So first off, John, I know it's tough to get up and talk about things like this. Want to do good out there. There's a lot of. And looking at your information, your request, I think it was for $50,000, and you've been working with the opioid. Sorry, I'm sorry about that. And you've been working with the opioid folks, and they're working with you to get the agreement or that put together. So the finance committee, what we do is we just, we like to have you come forward, tell us what's going on. This way we can understand, because then this way we can get the information out. So from here, what we have to do is just, we're going to move it to the full board. The opioid is folks, and who works, is Mary work out the agreement or?
So currently, the county board members who are evaluating agencies for opioid funds have recommended your agency to receive those funds. This committee will vote then to whether or not to move your request to the full county board.
I see.
The full county board will vote on it. However, in addition to that, there are specific restrictions in regard to how these funds can be used. So the state's attorney's office is preparing an agreement that all of the recipients will need to sign in the future in regard to that. So we're still in the process of getting that done.
So
Terrific. Well, thank you for that information.
thank you for clarifying that.
We're good at following rules.
Well, I'm sure you are, being a former policeman.
Exactly,
Yeah,
exactly.
I
And
appreciate- and
I
thank
was
you.
an honest policeman. This is hard for me. I was such an honest, I don't know, I can't talk money. It's hard for me to talk money. I see you have it up there. I mean, what we can do with that, but an honest cop, we on the street, we never talk money. So it's really been an impediment for Hero. Their president does not know how to ask friends and supporters for money, but
Well, you
it's
know what
just
you
my
do?
nature. I can do the work.
So you know what, John? Just keep telling your story, and more people hear your story and all the good things that you're doing, and the money will come.
Well, thank you.
You're doing a great job. And so I have let me just turn them all on.
Well, we can.
Okay. So whoever's in seat 10 was up first.
Well, that was John. But
Oh, John. All right. So Julie, all right, we'll just get ladies first. How's that?
So if no one had questions, I just was going to make a motion that we move this forward.
Second,
to the
Revis.
Board.
Previous Diaz.
Take a second. All in favor? All right, you're gonna be moving forward to the board. So thank you very much for your
God
time
bless
today.
each and every. Thank you.
Thank you.
I'll keep my promise
Okay. Thank you. Thank you for coming out.
and we'll keep up with the reports.
All right. Next one up is family guidance. Julie, you know the ground rules, so
I do. Actually, Sarah Richardson from Family Guidance is going to be doing the speaking for us today. She's in charge of the harm reduction, all of the harm reduction programs at Family Guidance. Okay, great.
Hi, good morning. My name is Sarah Richardson. I'm the Vice President of Harm Reduction and Outreach at Family Guidance Centers. I'm here to present on our Will County Harm Reduction van. Our COO, Ron Vlacity, was before the board on April 18th and received approval for this project. And at that time was also granted the first $75,000, which you see on the first page of our little presentation here, which was to purchase the van and design and retrofit that van in order to get it out in the community. We want to thank you all. We received that funding. The van is retrofitted, designed, and ready to go. And I'm here today to talk about the rest of our first year budget, which is $278,729 and what has been accomplished between that April meeting and today. Before we dive into the budget, between April and today, we have met with the police department in Joliet and have been assigned a liaison for our team, myself and the police, to ensure that they always know where we are and we're in communication. We've also met with the fire department and are establishing a similar relationship with them, as well as referral pathways into our comprehensive treatment infrastructure. And Ron Vlacity and our leadership team have also met with Dr. Kathleen Burke at the health department to ensure that we have a coordinated approach to our outreach across Will County. In terms of the budget, on the first slide here, you see an overview of a first year budget. Again, we've already received and expended the $75,000 on the van. We have about $6,000 in van maintenance and ongoing gas that we need to operate the van. Contractual services, which I'll dive into in detail on the next page, represents about a third of our annual budget. And then personnel, the staff that will staff that van, is also about a third. The rest of the rest of the items are materials and supplies, which are the things we actually hand out. And I can answer questions about that. And then travel, we'll talk in a minute about that, and our indirect cost rate of about 9%. So we can go to the next slide, which is a detailed budget. And I won't walk through, to be courteous for the 5-minute restriction, each line here. But to dive into the contractual, we have 2 contracts that are key to operating this program. The first is Invictus Security. We operate mobile harm reduction vans across the state, and we use Invictus Security on all of those vans. We have an armed security guard that drives the vans and helps our folks stay safe in the community. So that is the Invictus Security contract. The second is Comprehensive Management, which is the organization that Family Guidance uses for all of our HR, training, data collection, reporting, financial management tasks. So $55,000 of this grant would also be allocated towards that contract. Besides that, we are looking to hire 2 community engagement specialists. These are either community health workers or peer recovery support specialists who are trained to work with people who are using drugs, who are in pre-contemplation and contemplation stages of drug use, help them use safer, engage with harm reduction education and counseling, and move them towards treatment as they are willing and able. The rest you see is materials and supplies, the travel for both the patients we serve and our staff to get to and from the van when needed, and then our indirect costs. Next slide. Broadly speaking, and this was presented on before, so I won't take too much time, the goals of this program are to prevent opioid overdose in the county and address other harms associated with drug use, and then connect people to long-term opioid use disorder care at Family Guidance Centers. We are a very large treatment provider that offers outpatient, residential, temporary residential or STS beds, buprenorphine, methadone, naltrexone, and then residential and inpatient treatment for all other types of substance use disorders. So we can meet anyone with any use disorder where they are. And finally, our team will do stigma reduction activities and education in the community as well. Next slide. I will end here. The PowerPoint in front of you printed out is a slightly more updated version of this, but as I said, already completed April 18th. We went to the full board and it was approved. The vehicle is purchased and there should be a green check on May 20th. That was retrofit and wrapped and complete. We are hiring and training right now and ready to launch in early June as soon as we receive final approvals. I believe, oh, there's one final slide. We are ready. I am ready to come before you on whatever cadence you would like and recommend to report on data related to this program. I've listed some of the data, the baseline minimum data that we will collect and can report to you. And if there is other data that you're interested in having, we can work that into our data flows to ensure that we're able to report to you appropriately.
I would have I have a quick follow-up which might answer any of the questions that may be residual in nature. I think meeting with the Kathy Burke and her staff at the health department, meeting with the police, I'm presenting before the chief of police organization that has a representative there of every single police department that's in Will County. The first question they generally present to me is this redundant? And then what happens next? And I think this is what I want to be able to say the best way I can. There can be no redundancy in asking somebody to trust, come with me to treatment. There's a lot of Narcan information being presented out that saves that life, that time. There's a lot of possibilities out there in giving families information and giving people information regarding where treatment might be. Family guidance is 24 hours a day, 7 days a week treatment. That situation, my God, that John's family was presented with doesn't exist anymore because family guidance has 24 hours a day, 7 days a week, and provides that individual transportation from where they're at to the treatment facility. You know, one of the things I want you to remember is all the things that you do for your community. I read the missions here and I think about the presentations that you must get. And all of them come in and they're all worthy. They're all a part that fits together that makes what Will County is. The difference about this versus some of the other programs that may come before you, not the opiate-based money, but other programs, is somebody's building a park and they're making the community more beautiful. And they're in a place for families to go and be on a swing set. It's a great thing. I want to see those in my community too, and it won't matter. Life or death won't matter if that happens today or happens 3 months from now. When this van starts next week, there will be people walking up to this van that come out of tents, that come out of housing that is borderline, that walk up, and we must immediately start getting them to trust us. Because the next time they see us, it might be the time when they say, can I go with you? Will you save me? Can I bring you my son? This type of budgeting is challenging. I can't imagine everything that you do. What I'm going to acknowledge is all the stuff that you must do, but ask you to rethink if this is on your must-do list. And the number that is requested is the $278,000. I'm asking for you to approve it and have family guidance come back to you every month, every 2 months, whatever, and bill off of it on a quarterly basis so that you see the numbers. So you can ask, how many people went to treatment in that van? How many connections did you make with the families? How many times did you go to the tent community underneath Bridge Street? Or the one in Bolingbrook that's getting so big that DCFS can't keep the kids out of there fast enough. My point is this. You have this fund. This is for your community. I'm asking you to control it the best way you need to, but don't forget what you're doing with this money is saving lives. And you probably have other questions. Julie?
I just want to address that we did meet with Kathleen Burke to talk about duplication of services. I know that was a huge concern last time, and I think we've ironed all that out. And just to give you a little teaser, Family Guidance is also in the process that they will not be asking the county money for a mobile medication distribution van. Family Guidance delivers on what they say they're going to do, and they address gaps in services in the community.
Okay, questions? Julie and then Mark?
Thank you. Thank you again for coming before us. So I feel very strongly about these types of programs, your program and the Hero program. Because I know a lot of people, they're too afraid to ask for help. And a lot of family members don't know how to help them. It's very difficult. And a lot of times with serious illness or addiction, when a family is handed 3 pages of phone numbers and they say, call, and then you make those phone calls and everybody, they're gone or they're not available. It's very crushing. I never felt that there was redundancy with our health department and your program. So I'm glad you've had those conversations and that's clear. What I would like to see in the future, the information that I would like to have from these programs is just your coverage within the county, just to make sure that we are looking at the whole county. Our portion, Jackie, my district way out there on the northwest boundary. My children, my older 2 went to the schools with the highest suicides and drug overdoses. And it's still happening. And these are now adults. And it's still, the impact is still there. It's just that it took a little bit of time for it to happen. So I want to make sure that I wasn't aware that there was a tent community in the Bolingbrook area. I would like to learn more about that. If you could please share that information. And if we can just make sure that maybe we've got a plan to cover the whole county and cover it adequately. The other part of our population that struggles a lot is our rural and our agriculture. So I want to make sure that we're also looking to see what type of resources they require to support that population as well. So, but I thank you for everything you're doing.
In response to, that's exactly why, in order to mobilize a van like this and have the biggest and most effect, is the meetings that we've already started. The police departments, the fire departments, they're the ones doing the ambulance responses to overdoses. We're gathering the information and meeting with the health department and also the Center for
That's the
Correctional Concerns.
Center for Community Concerns, who deals with the homeless population.
They have they collect those numbers and they are willing to share them with us and with you, of course. And that's where you get them. Mhm.
Mark?
Plan. Oh, okay. So I think everybody agrees with you guys on the emotional side of this conversation. I do as well. I think you guys do great work. Very important for the people of Will County. But I have a couple questions about the financials of this. And then one, I guess, specific about this outreach data that we collect. So it might be easy if we start with this list right here. So like when you say number of referrals to treatment defined as warm handoff to treatment, what is a warm handoff to treatment? Is that just like anything we're just gonna, oh, well, we got them a kit and we gave them a card for an appointment. Is that a warm handoff to a treatment? Can you
That's
define
the
that for me
opposite
real
of a
quick?
warm handoff.
Okay, so that's a cold handoff, so.
Yeah.
Oh, go ahead, Sarah.
So a warm handoff to treatment means that we put someone in an Uber and we send them to our treatment facility, or we give them a bus pass. We send them, if that's how they prefer to get there. And then we are calling our treatment facility they're going to make sure they got there.
So we get you get confirmation that they have attended or at least showed up to that
Showed up.
location.
Yeah. exactly.
Okay, so that doesn't mean they went all the way through with it. It just was a appearance at the facility that they were supposed to be at.
Right, yeah. And so it just really depends on the type of facility. So we can send folks to residential, they might be there for many weeks. We can send folks to start dosing on methadone, and then they need to come back every day. So it'll be client dependent, patient dependent, but we'll confirm that they actually showed up on the first day, which is really one of the most important first metrics. And we can
And that's paid for by your
So,
organization?
right, so Family Guidance writ large accepts everyone regardless of insurance status or income. And so that is paid for. We bill and we have budgets associated with treatment. The transportation you see listed here is that Uber or bus pass that will get folks from this van to the various treatment locations.
Understood. I think this is all great information to keep track of. It would be nice to know like a little bit more that goes into each particular item on the list, but I think it's great. I don't know if it makes sense for finance though. I don't know if like public health or safety, just a thought. I mean, I know we make the financial decisions of the county. The next question I had, you had mentioned maybe paying this out in a quarterly type structure. What are the thoughts of our committee members on that? Just thinking if we wanted to, and they were going to collect such detailed data on the effectiveness of this program, would it make sense for us to do, at least the first 4 months of, or the first quarter of it, under this? I don't know if that causes too much confusion. If you're okay with moving forward, then I guess I am too. I'm not putting a stop in this. I just am curious about that component of it. That could be a nice thing we do, not only for this request, but other requests that come to the county, quarterly disbursements based on effectiveness and, product produced. Just a thought.
So, all good points, Mark. And so one thing too is that I know that the opioid, I'll call it committee, is still working with you, and they're working on trying to determine the level of financial support they're going to give. So I think that we aren't, we're not making a decision on this today. And I don't know when that decision is going to be made. But what we could look to do is just move this to executive, and then see if there's been some movement on the dollars and cents that are going to be. All right, so let me just finish then, all right? So, no, you don't have to call me sir. We're at this balancing point where they're working on getting all their ducks in a row. We had them here so that this way it doesn't get delayed, but at the same token too, there also still is that agreement that has to be worked out with Mary and that, which in turn is going to lay out some of the things, the terms and conditions and all that kind of stuff. Now, the only thing about doing a quarterly payout, I'm not exactly sure how we can do that from a finance perspective or how that can be. So Karen's back there. We can always have a conversation with her on how to do the logistics of that, because it does make sense. And the one thing that I did, I loved everything that you had to say, because you're going out there, you're doing the work that a lot of people aren't being reached that really need to be reached. But you're bringing back metrics, and the metrics are really something that are, you're going to prove to us that how well you're doing. Not that I doubt that you're going to do it, but you're going to, you're actually going to back it up with some statistics. So and I didn't mean to say 1 second, but yeah, occasionally I miss over here, Jack, so I apologize. So that's what we're going to do. I appreciate you coming out today. And so maybe Sherry, what I'll do is I'll take Jackie, and then if you could jump in maybe by Steve or something like that, or if you want to come up here.
I did.
You don't get it. No. You do. Let's work around the room. Jackie, then Sherry, then Mark.
It was kind of off of what we were just talking
Oh, really?
about.
Okay.
Yeah.
All right, then jump it.
Okay, so since we're not making this decision today, I thought we were making this decision today. The only thing I would maybe recommend to the opioid committee, if we can relay this message to them from the finance committee, I saw, and you covered it when you were doing your presentation of the budget, the security, the amount that you guys will pay for security and the management. I feel less about this towards the security. I think that's a pretty concrete need and, service that they provide. But the HR and the management companies, a lot of those things might be able to be handled, by one individual staff member and not some large contract for, I think it was 58,000 when we saw that. I don't know if that's something to look into. I don't know if it makes sense to have county funds go to that, but just something that I would recommend from my outside view, knowing that we have a little bit more time to kibitz on these things. Thank you.
So
I just wanted to say something for clarification. There is not an opioid committee. That is not a thing. It is 2 members of the county board who discuss and then make recommendations after discussing these issues with their caucuses. Yes, it's a working group. Yep. I didn't want it to appear that that was.
Thank you for the clarification and I
Mhm.
apologize for the calling them a committee, but Jackie and Sherry, if you want to.
Cherries on it.
Thank you, Chair Richmond.
Yeah, Sherry's on the opioid committee, so, or on the opioid working group. Sorry. So
I just have some questions about your organization. I missed the first couple of presentations you did, but I was at last month's board meeting, obviously. I think, Judge, you mentioned 7 days a week. If I'm on the right website, it talks about Monday through Saturday, no Sunday. I might not be on the right website.
Yeah, so that might be confusing. So we dose on methadone as most programs, Monday through Saturday, and people get their Sunday dose take home. We
Gotcha.
also have residential programs that operate 24/7. So it's just,
Okay,
yeah.
no, that's,
Mhm.
that's fine. That clarifies what I'm looking at. My other research showed that, your two locations where you do have residential treatment are Manteno and Springfield. Is that still accurate?
That is accurate. And both locations, recently, we started an STS program, which is one location has 3 beds, the other has 8 beds in Springfield. And folks can come in, they're experiencing homelessness or housing vulnerability, but they're not ready for residential yet. They stay with us for a couple of days, up to 5 days. They get a shower, they get food, they get clothing, and then they make that transition into residential almost always when they want it. So we're building out that continuum of care to help people feel ready to enter treatment where they are.
Okay. And then your locations here in the county are both in Joliet. Are those both like clinic kind of places or are they office spaces?
Yeah, so yeah, both. Mhm.
Okay.
So one is in the basement where the public defender is, where a lot of our clients come from. So they
Thanks, Julie.
do assessments and treatment there, as well as the Glenwood location does the methadone and does treatment there. And then the mobile medication, if you're talking about 24/7, there's Family Guidance is associated with the MAR Now line where you can call and they can give you immediate access to methadone. And that's part of what that van I kind of gave you a preview of that Family Guidance hopefully will be doing,
Yeah.
but not coming to you for money. Would be able to,
Sourced completely outside the
would
county.
be able to come and take care of those issues.
Yeah, that's fine. I don't have any issue with expending the funds. I mean, this is unanticipated money. This is from a lawsuit, a settlement. Anything we can do to make things better in our community. I have a dear friend who has 2 children, one who's now buried and the other one who has multiple times overdosed. And has now been in treatment for like second or third time for over a year. It is literally, I think, one of the hardest habits to kick. And I am an ex-smoker, an ex-nail biter. And I wish could say I was an ex-eater, but not. So, but thank you
How
very
old is
much.
your friend's child?
She is about 40 right now. Yeah, and hasn't really had a life. 40 years old. Can you imagine? Yeah.
My brother started in college and finally overdosed in his 50s.
Yeah.
And was back and forth his entire life.
These kids, the boy and the girl, they started in grade school, high school. Very sad. And parents didn't have a clue. So that hero presentation of the vehicle with the bedroom and all that, that really hits home. I think for a lot of parents, it's, we could probably use a few dozen of those in the county. So thank you very much.
So, Mr. Chair, can you explain to me then? I'm sorry. Sure. Oh, Sherry, I didn't see you there. Apologize.
thanks.
Okay, I just wanted to clarify as well that we don't ever know when the opioid money is coming in. So we don't know how much is going to be and when it's going to come in. And so that drives a lot of our decisions too. So we have to go work with what we have. So sometimes we may not have that much. So we have to do whatever we can. Also, Member Mueller had a question about, do you guys service any other counties and have you received opioid money from any of those counties?
Yeah, so we service the whole state of Illinois. These specific harm reduction vans were in the city of Chicago and then the south suburbs of Chicago. We also have a harm reduction program out of Springfield and the west suburbs of Chicago as well. We have not received previously opioid settlement funds. This is the first time.
Thank you.
Just to clarify, when you said service, do you mean the scope of services that Family Guidance does or just the harm reduction?
What you're suggesting here.
Oh, okay.
Sherry, thank you for clarifying that. I appreciate it. So, um, Vince, I think you had a,
Yeah, one quick question. Are you guys the same family guidance centers out of Glenview with Larry Kroll?
Yes.
Okay, that's it.
okay. So do we take a vote to move it to, oh, his is off.
Here, I'll just say you need 'em.
Okay, so what I'm looking for is a motion to move this to the executive committee meeting on 6/13/24.
Make a motion.
June 13th.
June 13th.
Yes, second.
Previous?
Previous logo. Second.
Okay, all in favor?
Aye.
All right, we're moving you forward to the executive committee on 6/13, so.
Thank you very
All
much.
right,
Thank you.
yeah, and you don't need to be there because I guess staff has everything that they need. Okay, all right, thank you.
Thank you.
Other old business, I see none on here. New business, we have 6 items. First one up is the corporate fund balance, the actual versus the budgeted.
I get a motion?
Anybody have any questions? Did anybody first off take a look at, have any
That's a good
questions? Rashawn's here, kind of go through some stuff with us or answer any questions. Yep. So I'll kick off with just kind of like a question observation, Rashawn. I noticed that we seem to be running a lot of negatives.
And I'll preface this by what this is. So this is the budget to actual for the first 6 months of the fiscal year through the end of May. A lot of the negatives are timing for some of the categories. Of course, the property taxes was due yesterday.
Mhm.
So the next budget to actual, we'll see a lot of that change. The property taxes, which is a bulk of the revenue, will be recorded in June. The licenses and permits, the percentage we've collected is 30% so far. Our building and zoning permits is slightly down, and I think that's due to the timing as well.
So you don't think it's like the economy or anything like that, or any,
A little bit is contributed, but the numbers, if you look at the detailed report,
yeah,
are not down that much.
yeah, oh, okay.
The other area is our intergovernmental revenue. We've gotten the monthly updates on our sales taxes, and that's just due to the timing of collection as well.
And then all that rolls down, because I noticed our cash reserves are down from,
Yes.
yes.
Yes, and that's that 6 months, the bulk of that is our payroll and other monthly financial obligations. So the 6-month report ending in May gives a snapshot of where we are, but the next report. And I know we're scheduled for, I think, the next one in October, maybe August, to do another one. So that'll give a little bit clearer picture as to where we are,
So you're not.
if you
losing
don't
sleep?
mind.
You're not
No,
losing sleep right now?
no.
Okay, good. That's good. Any other questions? Anybody have anything for Rashawn? So maybe what we'll do is work with Marcy and just put you on for you let us know when's a good time.
Okay.
When you feel that what things are, I don't call it good or whatever, from that perspective, to come back and just update us on the snapshot.
Okay, sounds good.
Great.
Thank
very
you.
much. Thanks, Rashawn. Assignment of tax sales certificates.
Motion, Revis?
Second for Second Diaz.
All in favor? Any opposed? Motion carries. Next one up is authorizing county executive to execute necessary documents for delinquent tax programs. Can I get a motion?
Motion, Revis?
Second Diaz. Second for
All in favor? Any opposed? All right, motion carries. Number 4, the appropriating of funds for the 708 board, that is going to be removed from today's agenda. And we'll just go on to number 5, appropriating a grant. Oh, do I need a motion? Do I need to get a?
Does he need a motion and a second to remove something from his agenda? Yes.
Okay, so I need a motion.
Motion to remove, Revis.
Second, Diaz, previous row for.
All right, all in favor? Any opposed? All right, motion carries. Number 5, appropriating grant funds for the Illinois Department of Public Health Student Loan Repayment Program grant. Can I get a motion?
Motion, but I'll have a discussion or a clarifying question.
So we'll get a second.
Second.
All right, and then discussion.
So how I interpret this is money going to one specific licensed professional that works for Will County that qualifies for the student loan reimbursement that we have laid out terms for, or was this that the state laid out terms for?
The state.
The state did. So, and we budget for this obviously, and
The state gives the funds to the county. So it's appropriating those funds into their budget to accommodate this student loan forgiveness.
understood. Thank you for the clarification.
So it's money coming in and then going out.
Correct.
That's all. Okay, all right. Any other questions on this? Can I get a previous
Previous Diaz.
and a second?
Second, Revis.
All right, all in favor?
Aye.
Any opposed? Motion carries. Last item, number 6, transferring appropriations within various county budgets. Can I get a motion?
Motion, Revis.
Second, Diaz.
Previous?
Second, Revis.
All in favor?
Aye.
Any opposed? Motion carries. Any other new business? Seeing none. Public comments. Anybody here from the public that wants to come up and comment? Public comments, anybody in the hallway, anybody online? Going, gone. Announcements and reports by the chair. The only thing I have is I know that Marcy has been meeting with all the different departments. You've been getting notes or that on a number of the meetings that she's attended. She has a stack about a foot high that she's working to get through, some of the significant ones being the sheriff's department. And I believe the health department was done no, Sunny Hill. So we'll be getting more notes on those, within probably this week or that. And that's all I have. No need for executive session. The only thing I need is a motion to adjourn.
Motion, Revis.
Second, Diaz.
All right, we are adjourned. Thank you, everyone.
You.